Hi, good afternoon, Mr. Coleman. Thank you for consenting for the thoracic and lung assessment. I do have a few questions for you at the moment. Do you have any respiratory issues like asthma, emphysema, or have you ever smoked?
No.
Okay, so first thing we're going to be doing is we're going to go ahead and inspect the thoracic cage, which is located here, and as we inspect, we're also going to be counting respirations. Normal respirations are going to be between 12 to 20 respirations per minute. As we go along, we will be assessing for any skin color abnormalities. As we can see, we have warm, moist, and normal skin color. I do not see any mass, lumps, or any abnormality at this time. I do see the patient is sitting up straight. There's no deviation. It is symmetrical. His facial expressions are flat, calm, and normal. As for the level of consciousness, I can see the patient is alert oriented times 4. He is into following commands. As we go along and move along, we will be palpating and confirming the symmetric expansion. So for this, you will put your hand side to side in the anterior and posterior chest at the same level with the thumbs over the sternum. And we will be assessing, we will be telling the patient to inhale. As the patient inhale, your thumbs should move apart symmetrically. For the tactile fremitus in the back, can you turn around for me, please? That way. Yes, thank you. We will be palpating here, side to side. And we're going to be checking for the most important part, which is being symmetrical. So increase or decrease tactile fremitus represent lung issues such as emphysema, asthma, pleural effusion, pneumothorax. Next, we're going to go ahead and check for or detect any lump masses or tenderness. There's no lumps, no tenderness palpated. Here we're going to go ahead and I don't know if you're going to be able to see this, but here we're going to be seeing the posterior auricular, superficial cervical, posterior cervical, the supraclavicular. There's also the submental node, as well as the submandibular, the preauricular in here, and the posterior auricular here. You also have in here in the back, you have the occipital lymph node as well. The as far as by the shoulder, the axilla, you have the lateral, the apical, the pectoral, the central, and the posterior. As we go along with percussion, we percuss over for lung fields, and we start into his right side, and we move along side to side here as the patient can breathe normally. Also, to estimate the diaphragmatic excursion, patient can be evaluated or the diaphragmatic excursion can be evaluated via the percussion. It is normal for the patient to have a 4 to 6 centimeters between full inspiration and full expiration as you tell them to breathe in and out. So it may be abnormal for atelectasis, the presence of pleural effusion, or at times with intra-abdominal pathology. For auscultation, we're going to assess normal sounds in all lobes. So basically we go again and we move along, start off with the back, and we start on his right side. Can you breathe for me? Take a deep breath. There you go. You go here. You go here. So you want to make sure that you recognize all the abnormals such as crackles, wheezes, and pleural rub. Normal breath sounds are classified as bronchial and vesicular. There's no adventitious sounds at all or any abnormalities upon this assessment. Okay? Thank you, Mr. Como, and I want to thank you so much for this assessment.